Hello, 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 everyone, and welcome to the Dr. Tamara Beckford Show. I am excited, as per usual, to have a wonderful guest here. Now, we all talk about burnout. We've all experienced it in some way or form. For us who are physicians, yes, the atrocity. We're dealing with it in very, very, very high levels. We have the equivalent of almost like a physician's class, which is like 2 to 300 of our colleagues that we lose their lives. And part of it is due to physician burnout, right? It is such a big topic that today we are going to talk all about it with our wonderful guest here, who she's not only talking about it, she has given us some ways to deal with it in her wonderful book, Mindful MD. So, this topic today is about the 6 mindfulness tips to restore autonomy and cure burnout. My wonderful guest for today is a graduate of Upstate Medical University. She did her residency in internal medicine at Mount Auburn Hospital. Then she did a fellowship at Harvard Medical School in medical ethics. She's a former hospice physician, part-time Harvard Medical School associate professor. She's a master certified coach for physicians. She is a mindfulness meditation teacher. She has coached over 500 physicians and physician leaders. She is the author of the book I just showed you, Mindful MD, 6 ways mindfulness restores your autonomy and cures healthcare burnout. She's also the author of 2 additional books, right? So in 2020, I don't know if you guys remember what happened that year, but she wrote a book that year called Everyday Resilience, a practical guide to build inner strength and weather life's challenges, aka 2020, right? Then 2013, she wrote Harvard Health Guide Mindfulness Support for Alzheimer's Caregivers. She's been featured in the New England Journal of Medicine. She's been featured on CNN, Medical Economics, and Oprah Magazine. Who am I talking about? This is my wonderful guest, Dr. Gail Gazelle. Woo! Welcome, 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 Dr. Gazelle. How are you?
I'm really good. What a pleasure to be here with you today. Your energy is just like so contagious tomorrow. I love it.
I love it, love it. Thank you so much for taking the time out to be on the show. All right, I can't wait to get into the 6 ways, but we want to take it back so we can get to know you a little bit better. So let's take it back to when you decided that you wanted to become a doctor. Tell us all about that.
Okay. Well, I wasn't one of these people who, like, from the age of 4, decided
Or
I
embryo.
not quite. But in college, I began to be drawn to the field of medicine, and I was really drawn to end of life care. I volunteered in a hospice when I was an undergrad at Cornell,
Mhm.
and I didn't really even know why I was
Right.
volunteering in hospice because I hadn't witnessed premature deaths or that kind of significant loss.
Mhm.
But somehow that's what captivated me.
Right.
And years later, as my life kind of trajectory and my medical trajectory evolved, it did begin to make sense because I, like many others, grew up in a very abusive home situation, unfortunately. And
Mhm.
the abuse was very isolating. There was a lot of silence around it. There was kind of the veneer that our family was a good family and these kind of things happened in bad families, this whole cover up.
Yeah.
And I didn't realize till later that it was that same isolation that people experience toward the end of their lives. Particularly, I went to medical school in the 80s. Hell,
Mhm.
wasn't yet a field.
Right.
And it was that connection that really drew me to end of life care, wanting to support people when they were isolated. On medical rounds in the 80s, you'd be with the team and the attending would be like, oh, there's a fascinating case of, fulminant pancreatitis. And we'd go in the room and the attending would pontificate. And then we'd go into the next room. Oh, this rare form of ovarian cancer. And everybody would ask questions. And then the attending would say, but we don't need to go in this room. She's just dying. And the
Oh.
team would go on. And that was very common practice then. It was, kind of like that's over there. That's not a.
Yeah, yeah.
So that's been my trajectory, and I feel like what happened in my childhood, of course, I wish hadn't happened, but it kind of gave me
Mhm.
my voice as a physician and my calling in many ways.
Interesting. Wow. It's interesting seeing how the phase of a medicine has changed, and
Mhm.
as I am listening to that story, it also makes sense as to why you're drawn to helping physicians with physician burnout, because the same isolation that goes
Yes.
on during that time. Wow. Alrighty. So you're in med school, you've been drawn to hospice, and then you're working now in hospice. So tell us, how was it during that time?
I loved my work as a
Okay.
hospice and palliative care provider. It was so rich. I did a lot of home visits, and you'd go to somebody's house and you'd sit in their kitchen or at their bedside in their living room. And it's such the opposite of, let's say, the chemotherapy suite, where the
Yeah.
patient is so vulnerable and
Mhm.
just wants to please the doctor so that they get good care,
Yeah.
and is kind of walking on eggshells, doesn't want to complain too much.
Hmm.
You go to somebody's home and there's such a sense of empowerment. It's incredible
Hmm.
for people to really tell it like it is, for their
Yes.
family members to share their fears and their anxieties. Family members not only are anticipating the loss of their loved one, but they're being asked to deliver morphine and clean up
Hmm.
IVs and, clean up bodily fluids and make medical decisions. It's really something. And there's so much more awareness about the importance of end of life care here now in 2024, but there really wasn't back then. And so I would leave a home visit and I would think to myself, wow, I get paid for this? It's such sacred work. It's really incredibly sacred work. And being at the bedside of people dying, being with their families, helping them manage, the plethora of really horrible symptoms that people have, respiratory, GI, etc.
Hmm.
It was incredibly rich work.
I love how you described it as being it's such sacred work, because when you think about it, and I remember talking about it. I did have an episode. I spoke to another hospice provider, Dr. Keyshawn Guidry, and the description that you both give of the care and the emotional difference between having a family and a patient in a hospice
Mhm,
environment, versus just directly in the hospital in dealing with this. And
mhm.
even from the hospice environment to home and dealing with it at home. And the difference, like you mentioned, when they're at home, they're in their environment, they're pictures of their loved ones. And, she said that with sitting at the table, you'll get stories.
Oh,
And
yeah.
it's okay to have the stories because this is my environment. You said that, it's empowering,
Mhm.
so I get to talk to you and let you know that my loved one is more than just this person who's dying. This is how they lived.
Yeah.
And that there's a difference between that than when you're in the hospital, everything is rushed. Like
Yep.
as you described the rounds.
Mm, yeah. And also, we get such a snapshot of people when they come into our emergency rooms or our
Yes.
wards. It's incredible. And we make so many judgments and opinions,
Mm-hmm.
particularly as patients get older and more frail. We can start thinking, well, of course they're dying,
Yes.
or, you know
Mhm.
what I mean? We
Yeah.
have these snapshots, and yet there's a fullness to all of our lives that we just don't always get to see in the hospital environment.
Absolutely. Whenever I have some of our nursing home patients come in, and they'll have their sheets, and it'll tell, like, their prior occupation, and a
Mm,
lot of NASA engineers and NASA, and so I'd sit and say, so tell me, Mr. Such and Such or Mrs. Such and Such, how was it? And tell me about that. And one of the I actually almost went into geriatrics because I know I was very close, but
yeah.
I in the ER I still get to encounter
Yeah.
my patient population that I love so much, because
Mm,
I learn so much from them.
yeah.
There are so many stories that are there that n- are untold,
Yeah.
and they're just willing. If you ask,
Hmm.
you can get it. All right,
Definitely.
so we're now talking about all the things that we love about how we enter and we are able to do things with healthcare. But one of the other challenge with healthcare is those of us who go into it, as you mentioned in your book, we're kind of prone to developing burnout.
Mhm.
Let's talk about the beginning of the book when you talk about that special.
Yeah.
Oh, you're so special. Tell us a little bit about that.
Yeah. Well, in the book,
Hmm.
Mindful MD, which I'll just say your listeners can download a free chapter at gailgazelle.com forward
Hmm.
slash mindful MD.
Hmm.
The big part of the book, the majority of the book, is the 6 ways that mindfulness restores autonomy and cures burnout. The first part of the book, which is small, I
Hmm.
call the roots of burnout.
Absolutely.
And, it's interesting for those of us who go into a career in medicine, many of us, academic achievers. And
Yes.
so as kids, we were recognized, oh, that's the smart one. That's the one who does good on tests.
Hmm.
And for many of us, some of our identity shaped around that. I'm the smart one. I'm the one who excels. I'm the one I raise my hand and I get kudos from the teacher.
Hmm.
And without even realizing it, we didn't develop a full identity of who we
No,
are. It was a partial identity around being this achiever.
absolutely.
And then we get into our medical training and we're taught that we're the captain of the team, the all knowing paragon, the one who always has the answer, even when there isn't an answer, like as you
Hmm.
say in the beginning of 2020, when there
Hmm.
weren't answers.
No.
And so I've noticed in myself and then in the hundreds of physicians that I've coached, there's a little bit of like, well, I'm special.
Hmm.
I'm Dr. Gazelle. And I
Hmm.
share in the book that, I was on a plane one time and I started chatting with the woman next to me on her laptop. And, we're chatting. And then I asked her what she did for a living. And all of a sudden I realized that I actually didn't really care.
Hmm.
What I cared about was being able to tell her that
What you did.
you know, and that part of the book, I've received so many emails from physician readers. They're like, Gail, I've got the same sort of chip on my shoulder, like that somehow I'm special.
Hmm.
It's wonderful to feel special. And it gets in our way too, because we're in a healthcare system now where the majority of us are employees. And
Hmm.
employees, by definition, are not so special. They're replaceable.
Yeah.
They're under the thumb, so to speak, of the employer. The employer calls the
Mhm.
shots. The employer just decides on the conditions of the workplace. And I think it's an under recognized aspect of burnout. We
Yes.
think we're special, we're the captain of the team, and then all of a sudden these administrators are acting like they're the ones who are in
Mhm.
charge. And there's a lot of dissonance for us there, in addition to everything that's going wrong in healthcare, which I by no means choose to minimize. It
Absolutely.
is mighty. All of the forces, all the understaffing, the under resourcing, the below grade tasks, et cetera, et cetera, et cetera. But there are some factors. And in our training as well, there are a lot of things that we learn. We learn to be very critical of ourselves, to
Yeah.
compare ourselves to our peers, never focusing on what we're doing well, but always shining the light on what we think we're not doing well.
Absolutely.
We don't learn how to be kind to ourselves, and that takes a toll as well. It makes it hard for us to appreciate the good that we're doing because
Mhm.
we're a little hyper focused on what we're not doing well.
Yes, I am glad that you're talking about that. I want to take a few moments and say hello to some people in the chat. So we have a Facebook user, and they're saying hello. I want to say hello back. I'll get to see your name after the broadcast is over. And then we also have Dr. Stevenson, Dr. Makanga Stevenson, that said, I love the story about the plane. It was so relatable. So for those who are just jumping on and talking about the plane, what we're talking about, unfortunately, when we grow up thinking that we're special and, going into medicine, you're having conversations with others, but you're really trying to just let them know that you're a doctor.
Mhm.
And it's a chip that happens, and once you recognize it, it becomes, you are a guest, because you're like, wait a minute, that's
Exactly.
not who I am as a person. How did this happen? And it's part of our, in addition, it's part of our training, right?
Yeah.
Captain of the ship, being the head, so you need to be the authority, and therefore you're in charge. And then now we're in this landscape where you're no longer in charge.
That's
And so we are, we
right.
don't know how to handle this,
Mm.
right? We don't
Yes.
know how to handle
There's
it.
another factor too that I talk about in the Roots of Burnout section,
Mhm.
which is that so much of our training is about proving ourselves, proving that we're smart enough, proving that we know the differential, proving that we've read the latest study. And
Mhm.
that actually, I think, gets in our way too, because it creates a little bit of a fear-based stance. And
A little, huge.
yeah, we some of us were pimped or shamed on
Mhm.
rounds. The focus was like, if you're not perfect, you're failure. I
Mhm.
coach so many physicians around charting and efficiency, and most of these physicians have two top things that are getting in their way. The
Mhm.
first is the sense that the note is not a note. The note is proof of worth. I have
Yes.
to write a good note because somebody's going to read it and they need to know that I'm smart and that they let me in for a good reason.
Yep.
Honestly, it's just a huge part of physicians, our
Yeah.
identity, having to prove it. The other part that really holds us back is perfectionism. I have to write a perfect note.
Mhm.
Many of us were English majors. We never wrote an imperfect sentence in our life. And then we've got to write these like tiny little notes and cut and paste and bullets and get it done and move on.
Mhm.
Those two things really derail us. It's incredible. Again, they're kind of in the shadows. And physicians then are forced to have these sit downs with their administrators, get your charts done. What's wrong with you?
Mhm.
Everybody else is getting them done. And the poor physician, feels like they're getting an F. And
Yes.
it's terrible. And they don't always even recognize what it is that's getting in their way.
That
So,
is a great point about the charting, and a lot of times you feel like the inefficiency, but the inefficiency is because part of it you're in your head and you don't want to be judged by what you're putting out there.
yes.
When this person reads this is a reflection of myself, and I find myself dealing with this exact same thing, and I'm glad that you're bringing it to light. They will say, "Are you a physician?" And you cannot even fill in the blank. This sentence structure is so, and it's like, okay,
Mm,
but is the information relayed to the next person who's reading this so they
yeah,
know what's going on so that they can continue the care? That's all the chart is about. It's
exactly.
not about how well you spell, as long as it's not like
Right.
horribly off. It's
Yes.
not about the sentence structure and if the predicate and the subject corresponds. It really isn't.
Oh,
Is the information relayed so that the next person taking care of the patient, are they able to capture that info and then use it to take excellent care?
yeah.
So
Exactly. Short and sweet. We can get the
sure.
points across. But it's also when we're mindful of what's going on for us. Oh, wow. Like I didn't realize I was really trying to prove myself, which is what a lot of physician coaching clients say.
Mm-hmm.
We're kind of diagnosing our own condition.
Yes.
And we all know we can't treat, i.e., intervene, until we diagnose.
Mm-hmm.
A lot of mindfulness and coaching is kind of diagnosing our own patterns. We have to
Yeah.
see, bring them into the light of day before we have any hope of shifting them.
Absolutely. Alrighty. Well, that brings us into we talked about diagnosing. So, one, you've recognized, oh, wow. So, we've just given you one version. That's if you're having issues with charting and you're realizing that you are trying to write the next novel and best-selling novel, but all we really need is the info. So now there's something to do, that we have a book here, the Mindful MD book. Um, the 6 ways mindfulness restores your autonomy and cures the healthcare burnout. So, because we know that charting is definitely one of the things that
Mhm.
leads to burnout. It might sound simple for those who aren't in medicine, but believe me, it really is a huge, huge barrier and it affects a lot of physicians. So, we now recognize, okay, there's something wrong. I am heading down this path.
Mhm. Mhm.
I want to use some mindfulness technique. There's 6 ways. So let's go over the six and then let's dive into at least the first two, because we want you to read the book to get the rest, okay? So we'll dive a little bit more into the first two, but let's talk about what are the 6 mindfulness ways that you have written in this wonderful book of yours.
Thank you.
Mhm.
Well, The first is recognizing that you are not your thoughts. And that's one that we will definitely delve into in more detail. So stay tuned.
Hmm.
The second is step out of mental stories. We'll get into that one as well. Stories about who we are, whether we're an imposter or not, whether we're good enough,
Hmm.
smart enough, etc. The third is mindfulness can really help us reduce our patterns of emotional reactivity, a place where a lot of physicians and non physicians get caught.
Yes.
The fourth is leaning into compassion, purpose, sense of accomplishment, and meaning, something that we can lose sight of in the day to day and the busyness and the below grade tasks. The fifth is working with what is, as
Hmm.
opposed to healthcare should be different. There
Hmm.
shouldn't be all these non clinician administrators. I shouldn't have to spend so much time on the care and feeding of the electronic health record.
Yes.
Doesn't mean we like any of these things, but we have to step out of all the stories about them so we can actually deal most resourcefully with what
Absolutely.
actually is. And
Hmm.
the sixth is the culmination of the other five, which is cultivating upward spirals. When
Hmm.
we're in burnout, it is a downward track. It's down, 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 down. Physicians tell me all the time, nothing is going well in my practice, Gail, nothing.
Yes.
And then there's almost blinders on to
Hmm.
anything that's going well. So we have to
Hmm.
take some baby steps and really look at the reality, not in a Pollyanna way, but in a realistic way about what is going well. What are you accomplishing, Dr. So and so, to help move upward? So that's a quick tour through the six, but
Let's dive into the first two.
excuse me.
Alrighty. So we're going into number one, the inner thoughts. I see a Facebook user already saying, yes, I am not my inner thoughts.
Good job.
Absolutely. Now let's talk about that because when we think about life, we think that our thoughts are just random and that we can't control it. And if it tells me, then that must be what's going on. But
Yeah.
let's go ahead and dive a little deeper into that.
Well, the human mind is an amazingly busy place. It's
Mhm.
estimated that the human mind produces 6 to 20,000 thoughts a day. I think for us in healthcare, it's probably closer to 50,000. We
Yes.
don't learn in our training how to work with all the thoughts. Many of our thoughts, obviously, are helpful. This is the right dose of a medication. I need to order specific tests. Mrs. X is struggling with whatever. This rash looks like Lyme disease.
Hmm.
Very helpful thoughts. But when we actually sit and observe our mind, we realize that a lot of our thoughts are downright wacky, really
Yes.
not helpful. They're fears, worries, preoccupations, ruminations, replaying, rehashing, retelling, accusations, as we talked about before the show,
Hmm.
shouting matches with somebody who actually isn't even present. Something that we perceive as unfair or
Yeah.
disrespectful. And we just don't learn to separate from our thoughts. We get so entangled in our thoughts that it takes us down a lot of very dark alleys, to say the
Mhm.
least. So, what do I mean by that? Well, in the book, I describe a physician who I call Mira, who, would get up early in the morning, would start berating herself for not exercising. Oh,
Mhm.
what a slug I am. I'm never going to lose those 15 pounds. I'm not like the surgeons who get up at 4:30 and be done at the Y or the gym and they're in the OR at 6 a.m. No, there's something wrong with me.
Yes.
Then she's trying to get her daughters moving in the morning. Oh, my daughters are such a pain. They're not like my sister's girls. They behave themselves really well. I don't know why they're yelling at themselves, like on and on and on. All of
Mhm.
these thoughts. She gets into the car. I hate my commute. Why are there so many people on the road? I never should have taken this job. She
Mhm.
starts thinking about her day in the office. Oh, it's going to be terrible. It's overscheduled. It's not fair. On and on and on. And she gets to the office and she's already so depleted. She
Yes.
barely has the energy to
Yes.
get her day. And unfortunately, this is what our minds do. Our minds
Mhm.
just go, go, go with hundreds of thoughts, really thousands sometimes in an hour. And
Yeah.
so I wish we had learned in our training how to work with the thinking mind.
Mm.
Sort through which of our thoughts are helpful, many, and
Yes.
they're not. And then what do we do with all those unhelpful thoughts, which is what mindfulness helps us learn how to do. We can train the mind to
Hmm.
be aware of unhelpful thoughts and to let them pass through rather than kind of just being so entangled.
Then yeah, just pass through. Don't settle. Don't take up
Yes,
roots.
yes,
Don't take up roots and take residence in this area. You can make it the highway
that's
and
right.
and go on through.
Yeah, because again, we so many physicians, when they really begin to realize that they're not their thoughts and that not all of their thoughts are factual,
Hmm.
it's amazing. Aha. I've had so many physicians say, wait, you mean I don't actually have to believe all of my thoughts? Because we just don't learn that. We don't learn that
Yes.
flexibility. We don't learn to question our thoughts. It's kind of
Hmm.
in med school and training the all powerful cognition.
Yes.
And we're
Isn't
not
it
throwing
interesting?
out the all powerful cognition. It's beautiful. I want my cognition. And I want to be able to work with thoughts that are simply just dragging me down.
But isn't it interesting how we develop these thoughts throughout life and we aren't taught? Because even by the time we get to medical school and we're deep in the training, we're putting so much info and data into our head. So we're thinking that anything that's in there must be data because
Mm,
that's what we're putting in. So
yeah,
these thoughts, when these thoughts come in, we're not thinking that these can't be true because we're so used to putting data in. So this must be some data that's stored
yeah.
somewhere. And it's like, no. And like you said, you're not your thoughts. When I realized that, the biggest weight
Mm,
came off my shoulders.
mm, mm.
And when I realize that I'm having this conversation with the person who isn't there, and yes, I know, no, you don't have to call psych on me because we all have it. And because I'm rehashing, as you said, we're most of our thoughts are rehashing our days, or this conversation I had with this other person, and we see it also on Facebook groups. I should have said this. I wished I had said that. And
Yes,
guess what that other person is doing? Not thinking about you. They have moved on. But
yes.
we're rehashing. For me, a lot of these conversations happen. I was mentioning, it was like when I'm in the shower. I'm like, it's the time of getting all these nice theta thoughts. And my theta thoughts are, I should have said this. Once
Mm,
I realized that and I block, it was the biggest weight.
yeah, it's incredible how much freedom there is. And I talk about this in the book. Each of the chapters ends with an exercise that you can do. And a really helpful exercise in this area is
I'm sorry, we're hearing. Of course, during this time, I don't normally have the person mowing the lawn, but today it is. So
oh boy,
we'll add the headphones so we can continue this wonderful conversation without the lawnmower.
excellent. Well, what I was going to say is we can imagine our mind being like the open sky, the big blue sky where clouds
Hmm.
arise, they pass through the sky, and then they dissipate. And really, thoughts are simply transient mental events, very much like the clouds that arise, pass through, and dissipate. I hope this noise isn't on my end.
No, it's probably, if it's a lawnmower, it's mine. If it's a leaf blower, it's my end.
Oh,
So, like you said,
we're
right in
still,
the middle.
we're still in winter in Boston, so we don't have those people out just yet.
It's a leaf. Well, I'm in Houston, so we know.
Yeah. We can train the mind to
Hmm.
begin to relate to thoughts in the same way. We can imagine our thoughts kind of leaving our mind, going up into a sky and passing through, and we don't have to hang on to them because they're simply
Yes.
clouds. They all dissipate if we don't get entangled with them and build on them. They all pass by. Every thought anybody has ever had, no matter how potent and scary and stormy it is, it passes.
Hmm.
And that's a really helpful technique that we can use to gain this mastery, to kind of stay with the thoughts that are helpful to us and let the unhelpful ones, the anger, the frustration, the woulda,
Hmm.
shoulda, the why didn't I, the self
Yes.
recriminations, we can just let them pass by. And that takes a weight off of us as well.
Absolutely, absolutely. I love the floating cloud. That's a little bit better than mine. I'm like, ah, make it a highway and just drive on by. But I like the clouds. It's a little bit,
Yes.
it's a softer way to
Yes.
approach this. And
Yes.
but it all, but both just let you know that you have the ability to control
Mhm.
if you want it to stay or if you want it to go, to
Yeah.
release the thoughts, and that it does not have to stay an anchor within you. Because as with the example and the story that you have with Myrna, if you listen into all of Myrna's thoughts before she got to work, Myrna is tired. She's done 8 hours of thinking of
Right.
what will, should, by the time I get it, I bet you this, these are all those thoughts. I bet as soon as I get in, A, B, C, and D is going to be happening. So even if it's not, how is Marina going to see the great or the goodness of what's going on during that day? She can't. She's already like,
So,
have it filled with what she is, and she's probably now looking for this negative thing.
well, the negativity bias that has such a hold on the human mind for each and every one of us, physicians or
Mhm.
otherwise, means that many of our thoughts drag us down, that we don't spend nearly as much time. If your listeners pay attention to their own mind and their own thought processes, 9 out
Mhm.
of 10 of our thoughts are something bad,
Yes.
catastrophic
Oh,
criticisms, judgments of ourselves and others. And
absolutely.
so, again, with mindfulness, we become the observer,
Mhm.
see what's going on with greater clarity. And there's tremendous autonomy, no matter what external autonomy has been taken from us as physicians and others in healthcare. This is the autonomy that no one can take from us unless we choose to hand it over to them. And that's
Absolutely.
the empowerment. That's really what I talk about in Mindful MD, how mindfulness restores the true autonomy that's available to us.
Yeah, which is within us and it's within our mind. I love
Yes.
it. So now that's one of the ways, we have that conversation, we have these inner thoughts, and then we have these stories. The
Conglomerate.
stories we tell ourselves. Go ahead.
Yeah, the conglomeration, the amalgamation of all of these thoughts is a lot of stories, a lot of, it's almost like there's a Mark Twain up there, kind of spinning yarns about ourselves, yarns about being an imposter,
Mm-hmm.
just simply a story that the mind has gotten attached to. Stories about our worthiness or lack of worthiness, stories about whether we're good enough or not good enough,
Mm-hmm.
stories about people around us. It's really fascinating. And I share in the book, the book is full of vignettes of real life physicians, but I'll share a story that's personal to me that may be
Mm-hmm.
helpful for your viewers. So I'm a mom. My son is now 26 years old. He was actually the co-author of Mindful MD. He's a
Yeah.
brilliant editor, so he edited his mom's work. And he's also a mindfulness geek.
Mm-hmm.
But when he was 17, he developed Crohn's. He became very sick. And life was really challenging, for him.
Mm-hmm.
I'm his only parent. I was single and used a sperm donor and had a child. And he's 26 now. He's the picture of health. He's on medications. His disease is very well controlled. But for many years after Davi was diagnosed, I had a whole story that I caused his Crohn's.
Mm-hmm.
I was a bad mother.
Mm-hmm.
I was a bad physician mother. Any other physician parent would have done better. That I was too selfish. I was so busy being an academician at Harvard and publishing and doing all these things that I didn't pay enough attention to my son. I was a bad mother. I fed him freezer food and not fresh greens. And I
And you didn't plant the food outside and grow it on
know
your own, right? Yeah. I mean, think about these the
exactly.
story.
Yes, because a good mother would have had the organic garden. You're exactly right,
Absolutely.
and would have raised the chickens and the goats.
Yes.
Yes.
And yes.
So I carried that story, which did nothing to help my son. It
Mm-mm.
certainly did nothing to help me. It was totally deflating. I just walked around. I couldn't really see anything good that I had done for my son because that story was kind of being broadcast in my mind.
Yes.
And you hear somebody else's story like this, and you can just think to yourself, come on, don't they realize that she didn't cause her son's Crohn's? But when we're enmeshed in the story, we believe it. We
Mm-hmm.
think it's the one and only truth, and it causes so much suffering. So I'm vulnerable there. It's a little embarrassing to tell this story, but I think it can help people begin to realize their own stories and just how fictional many of them
Mm-hmm.
are. They're not reality based. They may have a kernel of truth in them, but that's it. They're
Just a kernel.
just a kernel. That's right. Just a
Yeah.
kernel.
And when we think about it, I love that you have a, a way to help those who are reading and learn to filter. You talk about the two-step arrow.
Yes.
So let's talk about that a little bit to help those, because those stories are deeply embedded. The I am I got into med school by luck.
It's a
The
big one.
that's, and I think a lot of physicians. I even had my physician colleague last week who was one of the youngest physicians to graduate medical school in South Africa, and she got into med. Mind you, she's been getting honors, like, all in while in med school, but still feeling as like an imposter.
Yeah. Hmm.
So there's so many of us that have that,
Yes.
these stories that we tell ourselves.
Yes. Well, let's look at then the
Mhm.
two arrows,
Yes.
pain and suffering, which I talk about in the book, and it's an exercise that you can do. So there's a lot of pain and suffering in life,
Mhm.
right? It's part of
Absolutely.
life.
Yes.
Nobody really gets through the journey of life without some kind of painful event, a premature death, an illness, an accident, financial concern, loss of job, whatever
Mhm.
it is. Let's call that the first arrow of pain and suffering, kind of the facts of the matter. You
Mhm.
know, I broke my leg.
Okay.
That's a
That's
fact.
a fact.
Yeah.
Absolutely.
Or I'm a physician who used to be in private practice and have a lot of autonomy, but now I'm an employee. That's a fact.
Absolutely.
My son has Crohn's. That's a fact.
Mhm.
That's the first arrow, the reality. The second arrow is the journey the mind takes us on. So my
Mhm.
story, Ravi got Crohn's. I was a bad mother. I fed
Mhm.
him the wrong food. I caused his Crohn's. Any other physician parent would have done better than me. They would have known I didn't do anything good for my son. Those are the second arrows that caused me an unbelievable level of pain and suffering. And guess where those arrows were pointed? At my heart.
Yes.
Where the second arrows are pointed. They're only causing distress for us. Similarly, you could have a second arrow, and I tell this story in Mindful MD about a wonderful ER physician who got named in a malpractice suit.
Mhm.
He actually didn't do anything wrong, but they name everybody and their uncle in a
Mhm.
suit, so he was named. That's the first arrow.
Yeah.
Pretty hard for any of our colleagues to be named in a malpractice suit. Painful.
Absolutely.
So those are the facts, named in a malpractice suit. But then his mind went to, oh, this is going to be bad.
Mhm.
This is horrible. This is going to take years to resolve, and I'm going to be pulled down the drain. They're going to have my name on the front page of my local paper saying, don't go to him. He's a deviant. He's a rogue. He's a bad doctor. I'm going to lose my source of income. I'm not going to be able to pay the mortgage. We're going to be out on the street.
Yes.
Now, the case hadn't even gotten going. It's
Oh,
been
I could see that happening to me.
Those are the second arrows. He was so exhausted. He was waking up in the middle of the night, profusely sweating,
Yes.
exhausted the next day. He was getting irritable. He snapped at the new puppy. He wasn't showing up well with his wife and kids. Those are the second arrows. And guess which of these arrows we have control over?
That number two.
Number two, we have very
That,
little control over the first arrows. Crap
yes.
happens in life. It's part of the life trajectory for all of us. But where mindfulness restores our autonomy is by
Mhm.
helping us control the part that our mind is playing. And the second arrows are really there. So I encourage your listeners, to try this out. Whatever difficulty you're facing right now, what's
Mhm.
the first arrow? What are the facts of the matter?
Mhm.
What's the storyline that your mind is very, very busy spinning? Because again, once you see it, you can work with it. I could ask myself, is it true that I caused my son's Crohn's? No, that's
No.
easy talk. There's an etiology of Crohn's. It doesn't include the maternal mother, who did something wrong.
Right. Absolutely.
But we have to see the arrows and look at the story before we can actually challenge
I love it. And I do hope that those who are listening can really take a step and think about those two arrows. I thought that was a very powerful portion in the book, because it's something that we do so readily to ourselves.
it.
We are constant because of our training. Like we said, we're trained to find and trying to solve. And so in the midst of trying to solve, we add stories in. Well, that must have happened, and this must be the reason why. And a lot of those stories we're using to try to fill this void in trying to get an answer. And sometimes the answer is there is no answer. And then
Yes.
a lot of time the answer is no, you didn't do this to your son, or you didn't do this, you didn't cause this. No, you're not a bad person. No, you're not a bad doctor, which is that one is a very hard one. I
That
know
is.
others might see it as well. Is it ego? It's not an ego. A lot of this is a calling for us. And we
Mhm.
put a lot of time into it and a lot of training, as you can see, and even part of the stories that we've told you, a lot of our training is really extensive in getting the best information, using that information to make the best decision in short periods of time for the person in order to help them to be at their best or to improve. So when we are unable to do any of that, we see that failure.
That's right. And that gets spun into a whole I've always been a failure. I always will be a failure. Other doctors are smarter. They only let me in because on and on and on. So much anguish, so much unnecessary suffering on top of the very real suffering of being a physician in a very dysfunctional healthcare system.
Absolutely. So those two-step arrows, the two arrows, I think is very apt and it's a great exercise for you to think about when you find that second arrow is pointing at your heart. That's the say, wait a minute, wait, let me stop and think about this,
Yeah.
right?
Yeah.
And start to shed all of the negative part, those layers that
Yes.
start to come on, start to peel them back and realize that no, a lot of this is not true.
Yeah.
I
Yeah. I
love.
was coaching a surgeon actually this morning who told me he had a very relaxing weekend. He wasn't on call. He finally got some sleep, some time with his family. And then Sunday night, he started looking at his OR schedule, his outpatient schedule,
Mhm.
and this dread started creeping in. Oh, this is going to be bad. This is going to be a week from where. The other surgeon in the practice is off on, vacation in Hawaii. Oh, this is going to be terrible. I don't know how I'm going to cope with it. On and on and on. This whole story.
Yes.
And it turned out it wasn't that bad of a week. They actually had a locums covering the other doc. There
Hmm.
were cancellations. You know what I mean? The
Yeah.
is not a very good predictor
No.
of the future, but it convinces us this is what's going to happen. This fictional state that has never, may never come to be.
I love it. And that's exactly what it is. It's a fictional state that
Right.
we are telling ourselves it's real, and our mind, because doesn't know the difference between the thoughts that we put in it and the ones that are true. It's like, oh, well, I guess this must be our reality. And the answer is no. And that's when you can rein it in, as you're mentioning. And that's where the autonomy comes in, right?
Mhm.
You can,
Yeah.
knowing what we know now,
Mhm.
we can make that reality that we want versus having this thing go havoc and
Yeah.
making this fictional reality that's not there, that pierces our
Yeah.
heart. I
So
love that
emotional.
arrow goes to the heart. It's definitely
We don't need, there's enough pain without what the mind creates. There's enough suffering for the modern physician and for so many in healthcare. We
yes,
need to we need to decrease any unnecessary suffering.
absolutely. We have some more people that want to say hello. So we have um Temitope that's saying hello from Nigeria. Hello, Temitope. And she talks about the self-saboteurs. Absolutely. You
Indeed.
recognize that. And then we have Dr. Jerez Marte, facts versus a storyline. Talking to my teenage son about that tonight.
Good job.
Love it. Great job. Great job. The more, the merrier, so that we can try to enlighten the next generation, because a lot of us have gone through it and we're working through it now. And it's great that we can have them understand from an earlier
Mhm.
age, so that by the time they get older, they can know these are not my thoughts.
Yeah,
And
without
I
a
see where
doubt.
this is going.
The
Absolutely.
same surgeon who, talked about his training and, it was just being thrown under the bus right, left, and center. Really, how brutal surgical training can be, even now.
Hmm.
And he wants to be a role model. He
Yes.
wants to get a handle on what's going on in his mind so that he can do something different and so that the surgical trainees coming up the ranks have the benefit of somebody who isn't harsh, who isn't all about putting them down, and who
Mhm.
trains them not just in surgical techniques, but also in how to discern which thoughts are unhelpful, which
Yes.
stories are just yarns. So there's such a ripple effect that we can have.
Yeah, powerful, powerful ripple effect. I mean, medicine, the way that we were trained, doesn't have to be that way. We have so many people who can contribute, who have probably silenced themselves because of the thoughts or the older way of being trained, and thinking, well, what's the use? The learned helplessness that we all learn about it. So recognizing and wanting to be a role model, I really applaud that surgeon
Mhm.
for taking that step. And right, because how many new surgeons that we can have that now their minds are open, as opposed to being frozen
Yes.
into by fear, right? So because we know once you're relaxed, the ideas, the thoughts, the solutions, they pour in. Once
Mm.
fear comes in, you kind of freeze.
Yes,
So we're developing a way to have this new set of doctors be even better than us, in
definitely.
that we are now able to come up with better solutions, and to problems that are there. And it doesn't have to be based on AI. Like that's such a,
Mm.
they're just problem solvers
Yeah.
and connecting with the patients on a different level, which is another thing that I know. We talked about that connectivity
Mm.
at the beginning of this. So, with that in mind, I'm heading to Burnoutville on a personal level.
Ah,
So, for you, tell us,
yeah.
have you experienced burnout, and what did it look like for you?
Mm. Definitely. You know, um, I remember when my son was, 10 years old, let's say. And again, I was a sole parent, so I raised him alone.
Hmm.
I'd be home with him, and my mind would be thinking about work.
Hmm.
What about this patient? What about that patient? What about that article that I'm going to send in to JAMA, and be this
Hmm.
great, author? I'd be at work and I'd feel totally guilty that I wasn't home with my son. So, my
Hmm.
mind was just jumping around, jumping around. Here I am at Harvard Medical School. It's kind of like the Harvard Olympics.
Yeah.
I never felt like I was good enough.
Hmm.
Felt like I had to prove myself all the time. So I was just exhausted. And one day, Davi's Legos were all over the dining room and I tripped on one of them and I lashed out at him. And that's when I realized I had to make a change.
Hmm.
I changed jobs, I changed administrators. It was just like moving the deck chairs on my sinking ship, to be quite honest.
Hmm.
I really realized how much my own affect and my own reactivity and my own patterns of thinking were actually keeping me in burnout. So I actually lucked into having a coach. It was early on, this was probably about 15 years ago that I got coached. And it was unbelievable. The coach really believed in me. The coach challenged a lot of self-limiting beliefs. The coach kind of helped me build some compassion for myself, helped me work on patterns of reactivity. It really helped me get out of burnout and it helped me be a much happier person. People started saying to me, Dr. Gazelle, are you in love? Because I'm serious. I'm really serious. I had patients who would say that to me. And I was
You're glowing. You're
It was such a dramatic difference. I
Yes.
laughed more. I became a better mom, a happier doc. I'm sure I was better with my patients.
Mhm.
But that's when I decided to become a coach. And that's when I kind of pivoted from end of life care into coaching.
Mhm.
helping vulnerable doctors in a very complex and dysfunctional healthcare system.
And look at the effect of that, right?
Mhm.
That this one life, you're touching many lives on both sides. So you were touching the
Yes.
lives on one side of healthcare, and then now you're touching on lives on the other side. And
Yes.
so there's always this question out there, well, who's going to heal the healer?
Mhm.
And there are some of us out
Mhm.
here that's our calling in addition to the calling to medicine. So maybe our calling was not just to heal the patients, but also learn from that and be able to heal the healers.
Exactly. And heal ourselves, which then makes us more
Yes.
nuanced in healing the healers.
Yeah, absolutely.
Very definitely.
Yeah, love, love, love it. Alrighty, so now I am on to my fun question of the
Okay, I'm ready.
day.
I'm ready.
Alrighty, you're ready. Okay, here we go. So if you weren't a doctor and we can't be an author, okay, so you cannot play with Legos either because or go outside
Great.
gardening. What would you be?
I would be a happy amateur artist
Love it.
in a studio with lots of paints and lots of pretty fabrics. And that's what I would be doing with my time. I love doing crafts. It was such a positive part of my growing up, actually, and a big part of my healing journey as well.
Yes,
That's definitely what I would be doing. And my 5 dogs, I only have 1, but I'm saying in this fantasy,
of course.
5 canines would be stretched out on the around the fireplace as I was doing my art.
I love it. I can picture it now. And then a lot of them are just looking, lying and just looking at you.
Like, blissed out on life. Yes.
Yes, love it, love it, love it. Alrighty, so you have definitely added to my physician utopia that's in my head. Talk about mindfulness.
Yes. Good mindfulness.
I love, love, love this. So there's so many who have watched from all over the world today's wonderful episode, and they're thinking, well, where can I get this wonderful book of yours? This
Mm,
book, here it is. For those of you guys who are looking and you want to take a snapshot, it's Mindful MD 6 Ways Mindfulness Restores Your Autonomy and Cures Healthcare Burnout. Where can they find it? Where can
yeah.
they find this wonderful book?
Well, as I said, they can download a free chapter, get a taste of the book at gailgazelle.com /mindfulmd. And I'll also say, we offer a free listening session, and then we create a blueprint for well-being. So if you're burnt out, if you're worried that you might be burnt out, you can go to gailgazelle.com and sign up for a 20 or 30-minute listening session. We're really there to help people, physicians, physician leaders of every specialty.
Absolutely. Thank you so much, Dr. Gazelle, for being on the show today. Thank you so much for being one of our physicians who is here to help. Through your journey, you were able to learn more about coaching, about mindfulness, about how to heal oneself from the inside out. And with that, you are now helping the rest of us here to get through this and recognizing that, yes, and this is something that I say, we understand that burnout is multifaceted. And we understand that there are some parts of the system that a lot of parts that needs changing. But
Yes,
the autonomy portion within ourselves, we want to be able to hold on to that. So
definitely.
if you have decided not to give that part away, then mindfulness is definitely one of the strong techniques out there that you can use to help in this healing process. And Dr. Gazelle has a wonderful book with great stories, great vignettes, relatable stories that you can see yourself in and be able to use. At the end of each chapter, it's not just, at the end of each chapter, she has work because you're a physician and you're used to having exams. So at the end, of each chapter, there is a little bit of a workbook and some questions that prompts you so that you can definitely use the book and be at your best by the time you finish reading it. So thank you so much, Dr. Gazelle, for jumping
Thank
on. Any last minute thoughts that you
Well,
want to
such a
leave?
pleasure talking with you. Really a pleasure, and really wishing your viewers a lot of mindfulness, very pragmatic mindfulness that can help them build many, many moments of calm and ease in their days.
Yes, thank you so much. Thank you all for listening. I know some of you are sitting there thinking, okay, I just caught part of this. Oh, there we go, Dr. Beckford again. She always has such great guests, and I never catch all of it. Have no fear. This wonderful episode is available on our Your Caring Docs website. Just go to urcaringdocs.com, select podcast. You'll see our guests' beautiful face. Download that episode and definitely share this with your physician colleagues because this is one of those that we all need. Now, if you are looking for a dynamic speaker to speak on stress management and burnout prevention for your next event, I am she. Send me an email at drbeckford at yourcaringdocs.com, and I'd love to be a speaker at your next event. Thank you so much, Dr. Gail Gazelle, for being here, for sharing these wonderful thoughts with us and your stories, and most importantly, this book. And I'll show it for you again. Mindful MD, 6 ways mindfulness restores your autonomy and cures healthcare burnout. So, with that, we end today's wonderful show, and I will see you guys next time. Thank you so much for joining us. Bye bye.